Okay, welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health. My name is Dilshad Burman. I'm a writer and reporter with City and 680 News, and I will be moderating this chat today. Thank you so much for joining us, Dr. Dubey.
Oh, my pleasure again. Absolutely.
Wonderful. So how this works is we have been collecting your questions all week for the doctor. I will present them to her today. She's never heard them before. It's all off the cuff. And if you haven't had a chance to submit your questions, you can still do so under this live broadcast. And we're going to try and get to as many questions as we can in this short time that we have with the doctor. It's only 30 minutes, so I'll do my best to answer all of your questions. What we're going to do now is we're going to start with our cache of questions that I've collected over the week. We're going to start with vaccine questions once again, because that is top of mind and has been for quite a few months now. Doctor, are you ready to go?
Yeah, let's go.
Okay, let's start here. We'll start with Brenda. Brenda says, my husband got his first AstraZeneca vaccine at the end of March, and he didn't have any adverse reactions. Should he wait for the 4 months to get his second shot, or can he receive the second dose earlier?
Okay, so if you had AstraZeneca for your first dose, there's a couple things that you need to know. One is based on when you had it, you will be eligible for your second dose earlier. Actually, everyone is going to be eligible for an earlier second dose. When you're eligible for your second dose, your choices are AstraZeneca if the vaccine is available, or now the National Advisory Committee on Immunization just yesterday released their guidance that said you could get a messenger RNA vaccine, which means either Pfizer or Moderna. Right. So that will be, you'll have to watch to see when you will be eligible. What you do want is some spacing. Some spacing is good actually between that first and second dose, especially with the AstraZeneca. We know that, 12 weeks, about 12 weeks is better than say at the 4-week interval. And where can you get to then that second dose of either AstraZeneca or a Pfizer or Moderna? Well, the pharmacy that you got your first dose from, if they're still giving doses, might be able to give it to you. And otherwise, there are other pharmacies. Soon, when you're eligible, you will be able to also book getting just a second dose, say, through the provincial booking system, like at a city clinic as well.
Okay. And then Nico asks, I am a Canadian living overseas. Is there a plan for the government to get us vaccinated?
I don't know of a plan to send vaccines overseas for Canadians, but certainly anyone in Ontario, regardless of whether they're a citizen, they have OHIP, whatever, anyone who's here is eligible to be vaccinated.
Right, absolutely. It's not clear if other countries are actually doing that. I'm not really sure what the policies are. I guess everybody has their own, right? Okay, and then Sunshine asks, what percentage are we covered against COVID after getting the second Pfizer vaccine?
So when you have 2 doses of the Pfizer vaccine, the effectiveness of the vaccine goes above 90%. And the way you understand that is it means that you're 90% less likely to get COVID, to get sick from COVID. So that's what that 90% refers to after 2 doses.
Right. And then this person's alias is, it's me. I had my Pfizer vaccine on May 16th, and after a couple of days, I'm feeling very tired. There's loss of appetite. It's been more than a week. I don't have any other symptoms. Is this normal, and what should I do?
Okay, well, we do know that people can get symptoms, 20% or so, following their first dose of vaccine, really any vaccine. Most of those symptoms last for 1 to 3 days. Now, if the symptoms last for longer than that, either they're severe to start with or they're not going away, I do recommend that you follow up with your doctor or your nurse practitioner. They can decide whether you should report it to public health as an adverse event, for example, but also, are there tests that you should do? Are there treatments that you could have? So I would definitely recommend that you connect with your healthcare provider.
Right, okay. And then Jago asks, what about vaccines for transplant recipients? There's little known about the effects of vaccines in the immunocompromised. The US is the only source, and so far the outcomes have not gone so well. Are vaccines for immunocompromised people better than the alternative? It will take years for the study results to be known, they say?
Okay, so what we know in immunocompromised people, like whether you're a transplant patient and on medications or getting chemotherapy or have an underlying health condition, is that if you get COVID, you could get very, very sick with COVID. That part is very clear. Now, getting the vaccine, we know is safe. You're not more likely to have serious effects. The vaccine cannot give you COVID, so you're not going to get COVID from the vaccine. Right. We do know, though, that if you have a weakened immune system, you may not mount the best immune response to the vaccine. So, where most people after one dose in Ontario are getting 70% protection, you might not have that good protection. And so that's why if you're a transplant recipient, you can actually get your second dose sooner. And the idea there is because you didn't mount a good immune response to the first dose, we want to boost your immune system to give you the best protection for you. So I would definitely recommend that you get vaccinated. I would also recommend that those around you, people you live with, people that you have close contact with, that they be vaccinated as well too. So you're less likely to be introduced to the coronavirus.
Right. Okay, and then Brano asks, I got my first dose of Pfizer on April 8th. I did a test on May 10th and was positive for COVID. I finished the quarantine. What should I do about the second dose? When can I get the second dose safely? And does a positive COVID test have any impact on getting the second dose of the Pfizer vaccine?
Okay, so first off, I'm sorry that you got COVID despite being vaccinated. I hope, though, that it was a milder infection, that you didn't end up very sick. If you have COVID, you got your first dose, then you get COVID, you should still go on and get your second dose. And so it sounds like you're now cleared, you're free from self-isolation. And so when your second dose is due, and it's that shorter interval now, whenever it's due, you can go ahead and get that second dose of the vaccine.
Right. Okay. This is a conundrum, I guess. Moot asks, I got my AstraZeneca first dose in late April, and I have no intention of getting the second dose anymore. What are my options?
Yes, no one is going to force you to get the second dose of AstraZeneca. In fact, anyone who's taking that second dose of AstraZeneca needs to recognize that there is still that rare risk of that clotting disorder. Right now, that risk is 1 in 600,000. It's much lower than the risk after the first dose, but it is still there. And so if you choose not to get AstraZeneca for your second dose, that's absolutely fine. You can get a messenger RNA vaccine for your second dose. And so Ontario hasn't officially announced it, but NACI has given the clearance for that. And so there will be more guidance on that in the coming days, I'm sure.
For sure. Douglas asks, I'm not sure about this one, but Douglas says there is a new hybrid British India variant identified very recently in Vietnam. Is that here yet, and are our vaccines effective against it?
Yeah, so good question. Yeah, I read about that just like you in the media reports. And from what I understand, yes, it's a UK and Indian variant. So we have new names for those now from the World Health Organization. It's very confusing. I don't know that we have that variant here in Ontario. That has not been identified as far as I know. In terms of does the vaccine work? Well, we know that the vaccine works against the UK variant. We also know, based on data from the UK, that 2 doses of the vaccine, Pfizer or AstraZeneca, work against the Indian variant as well too. Okay. So that is good. Each variant on their own are protected by the vaccines. Whether this new combo variant, then you might expect that you would get some protection from the vaccine, but I certainly can't tell you that definitively right now.
Right, absolutely. And doctor, you were mentioning when it comes to variants and things like that, based on the fact that a virus constantly mutates and there will be different variants, do you predict then that, we'll have to take booster shots more regularly against COVID?
We're going to have to keep a close eye on that. I mean, the variants that we have right now, 4 of them of concern, and this is the old terminology, UK, Brazil, South Africa, and Indian variant. That's where the variants were discovered, but that's not the new names for them. Each of those variants actually has protection against the vaccines. So it's actually going to depend on what kind of variant we have in the future, whether the vaccine will or won't provide us that protection. So that's one thing. And then the second thing is, how long will the protection that from the vaccines that we have last us? And if that immunity wanes, that might be a reason for a booster dose down the line.
Right. We have a live question coming in here from Shanzeh. They ask, my question is about people who have heart rhythm problems. Can they get the Pfizer vaccine? For example, people whose hearts beat too fast, or people who have a heartbeat less between 52 and 60. Can such people get the Pfizer vaccine because they've heard that there are side effects related to the heart with Pfizer?
Yeah, okay, so good question. So what you're describing, either a fast heart or a slow heart, the vaccine is safe for you. What has been identified is there have been a higher number of cases that have been noted, clusters. In Israel and in the US predominantly, though it's being monitored around the world, following the Pfizer or a Pfizer vaccine particularly, and mostly young men, mostly following their second dose, and it's called a myocarditis or pericarditis. And so these are very different from fast or slow heartbeat. This is either inflammation along the lining of the heart or inside the heart. From what I understand, first of all, there's two things. One is more common after the second dose. Those who have had this condition, it has tended to be mild, treated conservatively, can be treated, and people get better. And the US CDC put out a statement last week saying that they still recommend vaccination because, first of all, it's not clear that this myocarditis, pericarditis, which occurs in general, whether you're vaccinated or not, it can occur. And so it's not clear whether, first of all, whether it's linked to the vaccine. And should there be a link to the vaccine, again, it's a milder illness, it can be treated. And again, with COVID, even in young people, you can get long COVID. Some people do get very sick from COVID. And so it's important to prevent the COVID in those situations.
Right. So, doctor, you actually said long COVID, and somebody just in our live feed here has asked a question. Esteban asks, are there any examples or the possibility of developing long COVID after being vaccinated?
No, that has not been identified. That, people can get symptoms for, a week or so following vaccination, but those symptoms do resolve, and there haven't been characterizations of, say, fatigue or the symptoms of long COVID have been identified as feeling tired, trouble breathing, a cough that doesn't go away. People talk about brain fog, difficulty concentrating, and those symptoms following vaccination have not been identified as far as I'm aware.
Okay. And then, okay, let's see. Sean asks, Sean says, why do you never tell us the death rates due to this experimental vaccine? Are the death rates after vaccination available somewhere?
Yes, so what I know about deaths following vaccination are that they are related to AstraZeneca vaccine, related to the VIT, vaccine-induced immune thrombotic thrombocytopenia, those rare and severe blood clots. Yes. That on average, 1 in 4 people who get those severe blood clots can die from them. So that is certainly something that's known and reported. So I think where people, there are, even on our Public Health Agency of Canada website, they have a whole section on those rare blood clots in Canada.
Right. All right, let's go back to our submitted questions here. Amy asks, when can a person get a vaccine after recovering from COVID-19? And is that interval the same for 12 to 17-year-olds?
Yeah, so once you've recovered from COVID-19 and your symptoms have resolved, you can, and you're eligible, which everyone is now, you can book your vaccine appointment. There's no need to wait a certain time period from when you have COVID to when you're vaccinated. early on in January, when we had the vaccine, we suggested that you could wait 90 days only because we didn't have a lot of vaccine. And so we know in those 90 days, you might have some protection. So let's give the vaccine to people who have no protection. So that's where that came from early on. But it's not that you need to wait. It is safe, and it will give you a boost response to get that vaccine after your infection at any time frame.
Right. Okay. And then Wings asks, I am fully vaccinated with Covishield for the first dose and AstraZeneca for the second dose. There were stronger side effects with the second dose, like sore throat and chills. Why did that happen? I thought there would be less side effects. Is it because the vaccines were from different makers?
Okay, yes. So Wings, you're right. After the second dose, usually people have less side effects than the first dose. So it sounds like maybe you didn't have any side effects after the first dose. Which is less common as well too. I think it's really hard to predict who gets side effects and who doesn't. What you can say though is everyone should expect to get side effects at least for the first few days up to a week or so. Right. And the side effects are often a sign that your body is developing an immune response. That's why you can feel tired. That's why your arm can feel very heavy or very sore, because your immune system is actually really activated right there in your arm, for example. And so that's probably why you felt these symptoms. Now, why did you feel it more often after the second dose? I don't think it's related to Covishield versus AstraZeneca. They are mostly identical vaccines, just a different name based mostly on where they were produced.
Right. Okay. And then actually we have a live question coming in here. It's not vaccine related, but we'll take it anyway. Rose asks, how long does the loss of taste and smell last after COVID? I know someone who's going on 5 months and still hasn't gotten her taste or smell back.
Yes, that's a very good point. And in some ways, it's not often lumped into long COVID, but yeah, these are some of these symptoms that people have. They're cleared from their infection. They're not infectious. They've had COVID many months ago, and some of these symptoms continue to linger. And so that's an example of where the loss of taste or smell has not recovered yet. We don't have very good sense of, is there a treatment that you can take to make it come back? Will it come back? How long will it take to come back? And so I'm sorry that your friend is going through that. It is kind of in the catchment of long COVID.
Right. And considering we haven't had it around for very long, we don't know when it's going to end, right? When those symptoms are going to disappear, for sure.
Yeah.
Okay, and actually Rose has a follow-up question. If I've received Moderna for my first dose and Pfizer is offered for my second dose, can I request Moderna if I'm more comfortable receiving the same vaccine as the first one?
Okay, so good question. So the National Advisory Committee on Immunization says whatever you had for your first dose, as much as you can, try and get the same vaccine for your second dose. But if it's not available, then go ahead with whatever vaccine is available. And so if you want, so you had Moderna. So wherever you got your first dose, hopefully they have Moderna still available. And so there are certainly pharmacies that have Moderna. Some clinics, like pop-up clinics, are doing Moderna. And so that's how you can try and ensure to get Moderna for your second dose.
Right. Doctor, would you say now there is a little more choice when it comes to getting, which vaccine you get? Because I know that, and even now, I believe the recommendation is get whatever vaccine you're offered. But people are still a little bit hesitant with AstraZeneca, with these other ones. Would you say there's more choice now? There's more possibility of kind of picking and choosing?
There's more guidelines, that's for sure. So no one is being offered AstraZeneca for the first dose. And really the only doses we have right now are Moderna and Pfizer. And those are also available for your second dose. So there is a small amount of AstraZeneca for anyone who had AstraZeneca for the first dose and wants that. Mm-hmm. If you had Pfizer or Moderna for the first dose, no one is giving you AstraZeneca for that second dose. And so, yes, I think we know a little bit more about what we call the interchangeability of the vaccines. Pfizer and Moderna are almost identical vaccines. And I know that there have been some reports of some people say, no, I don't want Moderna, I only want Pfizer. These vaccines, I call them like cousins or twin sisters or twin brothers. They are very, very identical. And so, they're pretty interchangeable. And so some of it is going to depend on, well, get the vaccine when you're offered it, because you want to be able to boost your immune system and get that better immunity. And if, Moderna is not available in your community, you take that Pfizer, for example.
Right, absolutely. And another live question coming in here from Irene. How would you know if you have gotten blood clots, I'm assuming after AstraZeneca?
Okay, so the severe blood clots after AstraZeneca occur within the first month. That's pretty well known. And so if you had your first dose more than a month ago, you don't have to worry about it now. The symptoms of a severe blood clot would include chest pain, trouble breathing, swelling in your legs, a tummy pain that doesn't go away, a headache that is severe, spots that form or bruises that are not just where your vaccine is, but all over. Those are the types of symptoms that you would have had. And if you have any of those symptoms, those are signs that you should, get medical attention.
Right. Okay. And we'll go back to our submitted questions for now. Wade asks, I got my AstraZeneca shot and they're telling us to get either Pfizer or Moderna now. It's a mix of different kinds of vaccines. So is this safe? And when will it be available at shoppers so I can get my second shot?
Okay. So yes, it is safe. If you had AstraZeneca for your first dose and get what we call a messenger RNA vaccine, Pfizer or Moderna for your second dose, it's safe. It's actually safer than getting AstraZeneca for your second dose, because we know that AstraZeneca has that rare risk of side effects. It is rare, but Pfizer and Moderna do not have that risk. So, and we know that if you get the Pfizer or Moderna, you might have a few more symptoms. So your arm might be a bit more sore. You might have a fever for a bit longer, not feeling well. But again, those symptoms resolve. So that is still safe. Now, the question is, when can you get it? Well, it's going to depend on your age mostly, because the province announced last week that based on your age, you will be able to get earlier second doses. And so right now that's being rolled out for 80-year-olds. And so you'll have to keep track of how old you are and when you will be eligible. In terms of, can you get it at the pharmacies? Some pharmacies do have either Pfizer or Moderna available. And so that will certainly be an option for you to get it at a pharmacy. Yes. You could actually call the pharmacy if that's where you got your first dose, whether they have these messenger RNA vaccines.
Right. And depending on your eligibility, you can get it based on age, like you said.
Yeah.
Okay, so another live question coming in here. Vashti asks, can you take the vaccine even if you have long COVID, like one of the symptoms is still lingering?
Yes, you can. So as long as you're no longer contagious, you can still get vaccinated, even if you have long COVID. Just because you have long COVID, it doesn't mean you are immune to COVID. It doesn't mean that you couldn't get COVID again. And that's why we want to make sure that you still get vaccinated.
Right, okay. And going back to our cache of questions again, you just already answered this, but I'll say it anyway. Jeff said, can you still catch COVID after getting the vaccine? And as you just mentioned, yes, you can. So we'll move on to the next question.
Well, that's a bit of a different question. Can you get COVID after the vaccine and versus after you get long COVID? So if you've had COVID, you can get COVID again. If you've been vaccinated, yes, there's a small chance that you could get COVID. The first dose protects you 70% of the time. And so the second dose up to 90%. So, people have gotten COVID despite being vaccinated. Very, very small. In Ontario, 0.06%, so much less than 1% of people. Yes. And it seems that they got it mostly within the 2 weeks following vaccination, again, when the vaccine is not going to protect you. Mm-hmm. And a milder infection, less likely to be hospitalized or have a severe illness.
Right. Yes, you're right. That was a different question. It wasn't the same as the vaccine. You're right. Thank you for that, doctor. Okay, let's move on to Carrie's question. Carrie from Twitter asks, if I had a reaction to the AstraZeneca vaccine, which is like hives, should I be worried about taking the second shot of AstraZeneca?
Okay, so if you have a side effect following the first dose of any vaccine, my recommendation is that you talk to your doctor about it. You'll have to determine how severe was the reaction. You may need a consultation from an allergist to see whether, whether that was a severe allergic reaction. Do you need to be vaccinated in a controlled setting, for example? And whether they might actually, in your case, recommend that maybe you don't get AstraZeneca, maybe you get Pfizer or Moderna for your second dose.
Okay. And then another question about where are we with the vaccine? So Trisha asks, where is the Johnson & Johnson and Novavax vaccine?
Well, they're not here yet, if that's a short answer.
Yeah.
The Johnson & Johnson, there is still some vaccine that is in quarantine by Health Canada, has not been released yet. They're still, trying to get more information from a quality perspective to see if they can release that vaccine. As far as I know, there has not been more Johnson & Johnson sent to Canada. And Novavax has not been approved yet in Canada. So we'll have to wait to see on that one.
Right. Okay. Going back again to these questions that we collected over the past week, Linda asks, Moderna is causing heart inflammation in some people. I have lymphedema and had some immediate swelling. Heart rate was a little weird. I had loss of energy and headaches. It lasted about 3 weeks after my first Moderna shot. Should I get the second dose?
Okay, so I think the best thing for you to do is to follow up with your doctor on that, because what medications were you on, what exactly were your symptoms. I think that that's the best course of action for you to take, and I would take it now, because then you're prepared for what you're going to do when you're due for your second dose.
Okay, and then a live question coming in here. I guess it's kind of a personal question, but Rose asks, if you personally had young children around age 13, would you vaccinate them? Or is the risk to them so low that it's not worth vaccinating them?
Okay, so I think it's important to, first of all, have youth help to make their own decision. I can tell you that in Toronto, it's approaching, it's over 40%, approaching 50%, I think, of youth that have already been vaccinated in the few weeks that we've had the vaccines available. A lot of these are youth deciding for themselves that, the pandemic has been very long and severe for them. It's more than just about how sick you can get from COVID. It's also about, could you bring COVID home and spread it to someone in your household, maybe a grandparent who might be more vulnerable, or being able to get back to activities that they want to be able to get back to. The risks from the vaccine are exceedingly low, and even this potential risk of the heart, myocarditis or pericarditis, is still not linked to the vaccine. It's still treatable, milder illness. And so I would still recommend that the vaccines are beneficial for youth compared to not. I can tell you, I can answer that personally, that I have a 12-year-old who before I could even have the conversation, made his own decision and booked his own appointment and wanted that vaccine. So I think but I do certainly think that parents should have the conversation with their youth on this, so that you can really come to a decision together.
Right. Okay, another live question here from Shanzeh. If a person's antibodies remain in their body after COVID-19, should those people still get the vaccine?
So yeah, when you get COVID, yes, you develop antibodies. That's how we actually fight infection, is with the antibodies. But what we know is that if you've had a COVID infection, it's not clear how long those antibodies from that natural infection last.
Right.
They seem to last 90 days. For who does it last longer, 180 days, or like 6 months or 1 year? And so even if you have antibodies, though, like you recently had COVID, yes, getting vaccinated is not going to be harmful, and it will boost those antibodies that you have as well, too.
Okay, and then we have 1 minute left, so I'm just going to squeeze in this last live question that's coming in from Tanya. Why do people still need a mask after the vaccine?
So right now, our rates of COVID, they're coming down nicely in Ontario, but they are still quite high. They're certainly not even close to zero. Not that you would need zero, but they're still quite high. And so while COVID is still circulating in our province, in our city. While people are mostly 1-dose vaccinated, we need to still get that number higher. We're at 70%. We need to still try to get it as high as we can and try and get more people with the 2 doses. Then we can start to see some of those measures like, going indoors and having a gathering with your family, or wearing a mask. We can then start to think about when some of those measures can be relaxed.
Right, absolutely. And that brings us to 1 o'clock. Thank you so much, doctor, for taking the time once again and for all your patience and answering all these questions. Thank you to everybody who submitted their live questions. If we didn't get to them, I do apologize, but the doctor will be back with us next week. And so we'll try and answer your questions then. Thanks so much, everyone. Thank you, doctor.
Bye.
Bye-bye.